Hi, I'm Kim Drocek.
Hi, I'm Allie Maloney.
Hi, I'm Anna Johnson.
We did our study on the effects of testosterone therapy supplementation on body composition in elderly males for our HNF 472 medical nutrition therapy class. Our camp therapy is performance-enhancing dietary supplements. We picked testosterone supplementation. Our hypothesis is that testosterone will increase lean body mass and decrease adiposity in elderly men. Testosterone is a major sex hormone in males and plays a number of important roles such as the development of penis and testes, the deepening of voice during puberty, appearance of facial hair and pubic hair starting in puberty, later in life, and it may play a role in balding, muscle size and strength, bone growth and strength, and sex drive. Levels of low testosterone are less than 300 nanograms per deciliter, high or excessive are over 1200, and they vary throughout the day depending on exercise, foods, medication, and time of day. Normal ranges are between 300 and 1200 nanograms per deciliter. Shown here is a chart describing the different levels of testosterone as men age. It also shows the levels of SHBG, which is sex hormone binding globulin. It is a protein in circulation that binds sex hormones, especially testosterone. The aqua box indicates the age of subjects targeted in our studies. Having too much naturally occurring or excess testosterone is not a common problem among men. Part of this may be due to difficulty defining normal testosterone levels or normal behavior. Blood levels of testosterone vary dramatically over time and even during the course of a day. In addition, what seems like a symptom of testosterone excess may actually be unrelated to this hormone. In fact, most of what we know about too much testosterone in men comes from athletes who use anabolic steroids, testosterone, or related hormones and increase muscle mass and athletic performance. Despite the notion that too much testosterone is responsible for impulsive, violent rage and stereotypical machoism, too little testosterone is a much bigger problem. Excess testosterone can cause problems such as low sperm count, heart muscle damage, muscle enlargement, weight gain, insomnia, increased risk for blood clots, and prostate enlargement.
Recently, more attention has been paid to the effects of testosterone deficiency, especially among men. After age 40, a man's testosterone levels decline by about 1% each year. Symptoms of testosterone deficiency in adult men include reduced body and facial hair, loss of muscle mass, low libido, impotence, small testicles, reduced sperm count and infertility, irritability, poor concentration and depression, brittle bones, and an increased risk of fracture. Testosterone prescriptions have increased about 500% since 1993. According to the Mayo Clinic, hypogonadism is defined as a condition in which the body doesn't produce enough testosterone, the hormone that plays a key role in masculine growth and development during puberty. You may be born with male hypogonadism or can develop later in life from an injury or infection. The effects and what you can do about them depend on the cause and what point in your life male hypogonadism occurs. Some types of male hypogonadism can be treated with testosterone replacement therapy. As a man ages, the amount of testosterone in his body gradually declines. Causes of lower testosterone levels include injury, infection, chemotherapy, genetic abnormalities, dysfunction of the pituitary gland, medications, especially hormones used to treat prostate cancer and corticosteroid drugs, chronic illness, chronic kidney failure, liver cirrhosis, stress, and alcoholism. Currently, testosterone therapy is approved primarily for the treatment of delayed male puberty, low production of testosterone, and certain inoperable female breast cancers. Testosterone therapy can improve the following: generalized weakness, low energy, debilitating frailty, depression, and problems with cognition. Different types of testosterone therapy have different levels of bioavailability. The types of testosterone in therapy include injections, gels, and tablets. These types of therapies listed are the most popular. Intramuscular injections are the most effective. When using testosterone therapy, the dosage depends on the individual person. Different dosages are given as tolerated based on age and other health issues. Possible benefits of taking testosterone include increased muscle, increased strength, increased energy, stronger bones, improved mood, improved sexual function. Possible risks include prostate enlargement, prostate cancer, sleep apnea, breast swelling, and excessive red blood cells.
The first study, Effects of Muscle Strength Training and Testosterone in Frail Elderly Men, was found in the Medicine and Science in Sport and Exercise journal. The objective of Study 1 was to identify the effects of strength training compared to testosterone supplementation on muscle mass in hypergonadal elderly men. This was a double-blind, randomized, placebo-controlled study. The participants were given weekly injections of 100 milligrams of testosterone and/or progressive resistance strength training during a 12-week duration. There was no significant effect on the functional performance in the results, but testosterone increased lean body mass. We gave this study an A-.
The second study, Effect of Testosterone Supplementation on Functional Mobility, Cognition, and Other Parameters, was found in the Journal of the American Medical Association. The purpose of this study was to evaluate the effects of testosterone therapy in older men with low levels of testosterone. This is a double-blind, randomized, placebo-controlled study. Researchers gathered a subject bank of 237 healthy males between the ages of 60 to 80 years old with testosterone levels less than 13.7 nanomoles per liter. Participants were given 160 milligrams of testosterone orally per day. 80 milligrams were given in the morning and another 80 milligrams were given in the evening. The study lasted for 6 months. Researchers found an average increase in lean body mass of 1.2 kilograms, an average decrease in adiposity of 1.3 kilograms, and there were minimal adverse effects for the dosage given. This was graded an A. Study 3, the effects of transdermal testosterone on bone and muscle in older men with low bioavailable testosterone levels, low bone mass, and physical frailty. This study was found in the Journal of the American Geriatric Society. The purpose of this study was to explore the effects of testosterone supplementation on muscle, body composition, and physical performance in elderly men. This, too, is a double-blind, randomized, placebo-controlled study. The participants were required to have a testosterone level less than 350 nanograms per deciliter and be older than 60 years old. 131 men were included in this study. Participants were given a 5 milligram per day transdermal gel patch. This lasted for about 2 years. Researchers found an increase in lean body mass, a decrease in fat mass, and no change in muscle strength. We graded this study an A-. Overall, we give our evidence a 2, or fair. The studies were well designed, but they do not use consistent interventions such as types of testosterone supplementation given or length of the studies. Testosterone supplementation is not recommended. Although the studies proved that it increases lean body mass and decreases adiposity in elderly males, there were no changes in muscle strength or function. Also, there are adverse effects such as an increased risk of prostate enlargement and cancer. There are not enough long-term studies confirming proper dosage or other long-term side effects.
References. Woohoo! More. Woohoo!